back to Toasted Travelers.
Thank you for having me.
Yeah, thank you for being here. I'm excited to talk about mental health today because it is such a serious topic. I think I just want to start out by you introducing yourself, tell us a little bit about your background and what you do here at Next Move.
Gotcha. So I'm Caleb Skyles. I am the Director of Recruiting here at Next Move. I am also a registered nurse. I was a travel ICU nurse for about 5 years before joining Next Move. And I'm also an influencer here at Next Move. So I'm in most of the social media content. So yeah, should be familiar.
Yeah,
Right.
Yeah, a familiar face. So just a little disclaimer, mental health is such a personal experience. So just feel free to share whatever you're willing to share with us today.
Thank you.
Can you, not to cry too much,
Sure.
but would you be
Cry
willing
away.
would you be willing to share, just if someone's watching and they're struggling and they don't know how to deal with these certain situations, like would you be willing to share a situation that you went through?
Sure. So like I said, I remember very vividly one of my first panic attacks that I ever had. So my first year as an ICU nurse, I was on something called the rapid response team for our hospital. What that means is if you're part of the ICU, you're on this rapid response team that if a patient is coding or starts to decompensate, so it looks like they're getting really sick, could possibly start actively dying soon, then you're on the team that's going to go resuscitate them or be part of the team that's helping resuscitate them. And honestly, even though it's kind of morbid, that part of the job was actually kind of exciting. I think what a lot of nurses that would watch this can identify with that. It's kind of one of the adrenaline parts of the job.
Right.
But yeah, got the rapid response team bag. I'm going up to take the elevator up, everything's good, and the elevator opened, and I just had this wave of vertigo. So vertigo, pins and needles, felt like I was gonna pass out. But at the meantime, it's like, okay, you have to resuscitate this patient. You have to go start performing CPR, start delivering life-saving medications and things like that. So you really don't have time to take care of yourself in that moment.
Right.
And to be honest, I had never really had a full-blown panic attack before, so I don't think I understood what was going on. I kind of just thought I was dying.
Yeah.
So I was like, we'll take care of this patient first, and then we'll figure out what this is. So I ended up going through that entire code situation, more or less with this impending doom feeling going on. I remember getting back down to the ICU, going to the bathroom and just running cold water over my face and being like, dude, what just happened?
Yeah.
And yeah, I mean, that was my introduction to, hey, you may have some issues going on mental health wise, let need addressed. And unfortunately, even within recognizing, it took me some time to get the help that I needed from it.
Really?
Yeah.
Oh my gosh. So sorry that you went through that.
That's okay.
It's also sad that it's so common and,
Sure.
most people just don't know what to do. Most clinicians don't know how to deal with those things. So that's why I feel like these types of videos are so important.
Yeah, absolutely. I think that one thing I realized after I've shared that story before with other peers and nurses and stuff, and it's actually a lot more common than I thought, and that helps. Knowing that you're not that it's not a kind of unique situation, but that it doesn't mean that you're super weird or it means that you're weak or something like that. I mean, it is a kind of a stress response that you deal with.
Do you feel like you and other nurses talked about that a lot throughout?
It just kind of depends. I mean, it's like one of those things on if you, especially, I was a traveler for most of my career, so I'm going to look at everything through the lens of being a traveler. But, as a traveler, different hospitals, you kind of have groups that you vibe with or whatever, and people you make fast friends with. And for some reason, I think you can kind of tell when other people are as anxious as you are or maybe deal with some of the same things, and it just kind of becomes easy for you to share that kind of stuff. It's probably not something that I would just walk in and it's, hey, I'm Caleb, I have panic attacks sometimes, but it's it is something that once you share once, it becomes easier to share.
Okay, that's good. But why is that? Why do you feel like you couldn't talk about it? I'm just curious.
Sure. I think what, again, even though it's the best it's ever been in terms of mental health awareness in the country,
Mm-hmm.
I think there's still some stigma around it. You know, there's also, again, that feeling of like, am I the right person for this job?
Mm-hmm.
Like, you know, if somebody's life is in my hands and I can't make it out the elevator without feeling like I'm dying, does that mean that there's something wrong with me? Should I be providing care? So a little bit of imposter syndrome,
Mm-hmm.
I would say.
Yeah, that makes sense.
So yeah, I think there's a lot of reasons, and I mean, people just don't like to open up on things. So
Mm-hmm. Yeah,
yeah.
that makes sense.